Today we're going to go over a shockwave treatment for patellar tendinopathy, patellar tendinitis. Patellar tendinitis is pain in the front of the knee along the tendon, usually above or below the kneecap. And shockwave can be very useful, especially for cases that are having trouble recovering more than a few months, that it's not getting better. Might need to restart the healing process through something like shockwave. Shockwave penetrates into the tendon, encourages your body to incite a response to it, which will then help the tendon start healing again. So we're going to go over some basic areas where we tend to apply this that get the best results. Some of the most common areas people have pain is right underneath the kneecap or anywhere along the tendon, inside, outside, and sometimes right down the middle, or sometimes down here where it attaches to the bone on your lower leg of your tibia. So we're going to do some shockwave along this whole tendon from the kneecap down to the tibia. Intense. Another spot on the patellar tendon that we often hit is above the kneecap. So sometimes this is called the quadriceps tendon. It's still part of the same tendon from all the quad muscles here. You start feeling the tendon mostly around here, down to the kneecap. It basically goes through the kneecap, and then you can feel it again down here. So now we're going to treat from here up into the upper parts of the tendon. Turn it down. So we've treated both parts of the tendon, the top part of the tendon and the bottom part of the tendon. Now we'll do some passes through the quad muscles. So the quad muscles are what become the tendon. So we're going to hit the inside of the quad, the middle of the quad, and the outside of the quad with a few hundred pulses each of the shockwave. If there's any spots that feel tender, we might focus on those. His pain's mostly on the inside, so we're expecting there might be some more spots on the inside that we'll focus on. So as we're doing this, you might see some twitching through here. It's usually when we hit spots that are hypertonic or what are called knots. People feel trigger points, another name. So that's a lot of times people feel that's the area that's most tight, or they feel they have knots there. Or that's a spot they've maybe been massaging on their own. With the shockwave, little twitches hopefully mean it's relaxing a little bit. Any extra? More?
Yeah, it feels pretty good.
Okay.
I just felt looser.
Good. So we just went through basic treatment for what we would do with patellar tendinitis. We usually hit the tendon above and below the kneecap, as well as through some of the muscles of the quad. Usually about 400 to 500 pulses in each spot. We do this once a week for usually 4 weeks to start. That'll start the healing process. We always combine this with exercises, especially to load the quadriceps and the patellar tendon to encourage muscle building and tendon building. This usually gets the best outcomes. We got to pair the shockwave with the loading to really see the tendon improve. A lot of times people will start noticing some difference after the initial 4 treatments in about a month, though the maximum improvement usually occurs a few months after that as you continue to load it and the tissue continues to heal on its own. If any additional treatments are needed, we may do a couple more further down the line if it's not quite where we want it to be. If you have any questions about shockwave, please feel free to put them down in the comments below. Any questions about patellar tendinitis, also put those down below, and we'll be hopefully able to answer any of those questions for you.